What's up YouTube? My name is Jimmy and welcome back to my channel Envisage. In today's lesson, we will discuss the overview of anemia, followed by the characterization of different types of anemia, clinical manifestation, and finally the drug treatment acronym for the different types of anemia. So anemia is the deficiency of healthy circulating red blood cells that are able to exchange and provide oxygen. So the characterization of red blood cells can be classified through a test known as mean corpuscular volume. Mean corpuscular volume is a measure of the average volume or size of the red blood cell within the bloodstream. They're classified either as microcytic, normalcytic, or macrocytic. Microcytic means that the average red blood cell falls below the normal size or volume range. Normalcytic anemia falls within normal size or volume range, and macrocytic falls above the normal cell size or volume range. So under these different classifications of anemia lies a defining characteristic that attributes to the mean corpuscular volume of the red blood cell. They include cell stacking of the red blood cells, flexibility of red blood cells, as well as the effectiveness to deliver oxygen. So we will utilize these attributes as we explore the clinical manifestation of the different types of anemia. Microcytic anemia, or one of the most common, is the iron deficiency. It's one of the subtypes of microcytic anemia, and iron is usually needed for the production of hemoglobin. Without iron, the production of hemoglobin is then compromised, as well as a lack of oxygen transportation. This would explain why the mean corpuscular volume in iron deficiency is usually smaller due to the lack of hemoglobin. Normally, oxygen binds to hemoglobin, which consists of 2 alpha and 2 beta subunits. Because of the lack of hemoglobin, oxygen transportation and exchange cannot take place as efficiently, thereby leading to cells' deprivation of oxygen. As we know, oxygen is the last electron transport acceptor in the electron transport chain. The electron transport chain is what drives most of the ATP production. So those who suffer from anemia would often feel fatigue due to the lack of ATP. Another form of microcytic anemia is called thalassemia. Thalassemia is further divided into 2 different forms, known as alpha and beta thalassemia. From previously discussed, we know that hemoglobin is made up of 4 different subunits, 2 alpha and 2 beta subunits. In thalassemia alpha, either one of the alpha subunit or 2 of the alpha subunits are missing due to genetic mutation. This same scenario could happen to the beta subunit as well, where the genetic mutation could either affect one of the beta unit or both of the beta unit of the hemoglobin. Beta thalassemia is more frequently observed in the Mediterranean population, and alpha thalassemia is more frequently observed in the Southeast Asian and African descent. Lastly, we have hereditary spherocytosis, which is another form of microcytic anemia, where there's a genetic mutation that is involved in the protein mutation that affects the red cell's ability to form its shape. These proteins are known as ankyrin, spectrin, as well as band 3 proteins. As a result of the lack of membrane proteins of the red blood cells, they tend to form a spherical shape. The red blood cell cannot maintain their bicon disc shape, which as a result makes it harder to travel into narrow blood vessel, and they're more prone to be destroyed by the spleen. So one of the main functions of the spleen is to eliminate any red blood cells that is damaged from the bloodstream. So if the spleen cannot clear the red blood cell over time, there is a potential buildup, and this buildup causes the spleen to enlarge, and this is known as splenomegaly. Splenomegaly can potentially result in potential fluid backup to the liver, as well as an extension to the stomach, which can present clinical manifestation of liver failure. And if you want to have a better understanding of the clinical manifestation of liver, please click over here, as we previously discussed the clinical manifestation of liver. The next type of anemia is known as normalcytic anemia. Normalcytic anemia means that there is no change in the mean corpuscular volume. we will explore the different types of normocytic anemia, which includes hemorrhagic, G6PD, aplastic anemia, and finally, sickle cell anemia. So hemorrhagic anemia is caused due to a loss of blood volume. And when we lose blood volume, we also lose red blood cells. Examples of hemorrhagic anemia includes traumatic injury, gastrointestinal bleeding, and menstrual bleeding. Aplastic anemia is another subtype of normocytic anemia, where the bone marrow does not have the ability to adequately produce red blood cells, white blood cells, as well as platelets. This type of anemia, named aplastic anemia, tends to carry a misnomer because it not only affects red blood cells, but it also affects white blood cells as well as platelets. G6PD anemia, ultimately, to put it into simple terms, is an increased damage to the red blood cell due to insufficient glutathione production to counteract reactive oxygen species. Okay, I know that was a lot, but that's just the gist of it. So let's first explore in details the mechanism of action and followed by a real-world example. Glucose is first converted to glucose 6-phosphate via the enzyme hexokinase. Glucose 6-phosphate is then converted into 6-phosphogluconate by utilizing an enzyme G6PD with NAD positive as a cofactor. This process is important because if there's a lack of the G6PD enzyme, then there is less NADPH being created, which means that less NADPH is used to reduce GSSG to GSH. So GSH is actually the reduced form, and it's used to reduce reactive oxygen species. GSSG is the oxidized form of glutathione. Glutathione is the main enzyme that acts as an antioxidant in our body. So if there is a decrease in G6PD enzyme, then the red blood cells have a higher chance of getting destroyed, thereby causing hemolytic anemia. Let's envision the G6PD anemia with a real-world example. Think of NADP and NADPH cofactor as the trivet that helps transport a hot pot from the stove to the table. The trivet is not used up during the process and is used only as a mean to help transport the pot. If there is no trivet during the process, then the person who's handling the hot pot is more prone to get burned and damage to their hands.
Ouch!
Similarly, if there is no G6PD enzyme to convert into NADPH, then there is no glutathione, which as a result can increase the likelihood of the red blood cell interacting directly with the reactive oxygen species. And as a result, these red blood cells are more prone to get damaged during the process. Lastly, we have sickle cell anemia. Sickle cell anemia occurs due to a point mutation, which occurs as a result of a 6-position amino acid change on the beta globin from glutamic acid to valine. Let's take a look at the amino acid. Notice the change from a charged amino acid group to a more hydrophobic side chain. This, as a result, will change the protein conformation, and via van der Waals forces, they will behave differently in terms of the protein folding. Sickle cell anemia is characterized by the sickle cell shape that is formed when the hemoglobin molecule polymerizes when it is not bound to oxygen. As a result of the sickle cell shape, these red blood cells are more prone to stacking on top of each other, potentially causing the occlusion of blood vessel, known as vaso-occlusive crisis. Sickle cells are a genetic adaptation to prevent the survival of Plasmodium, which is a malaria-causing parasite. The final type of anemia is known as macrocytic anemia. The macrocorpuscular volume for macrocytic anemia is usually larger than the average size. This is mostly due to B12 and folate deficiency. So how does folate and B12 contribute to the increased size of the red blood cell? Both vitamin B12 and folate are needed for DNA synthesis. The absence of vitamin B12 and folate will affect the DNA synthesis process, and will halt the maturation process. As a result, the immature red blood cell will remain as a megaloblast. Megaloblasts are the precursors of red blood cells and usually are larger in nature. Megaloblasts also have a defining characteristic such as the giant nucleus in comparison to the cytoplasm. So, due to the insufficiency in folate and B12, the cells cannot divide and the nucleus will continue to grow in size. Next, we will go over the clinical manifestation of anemia, which includes fatigue and weakness, pale skin, shortness of breath, rapid irregular heartbeat, cold hand and feet, and other more rare instances such as restless leg syndrome and increase in clot formation. So as a result of the decrease in red blood cells, patients often feel more tired due to the lack of oxygen. As previously discussed, the lack of oxygen decreases ATP generation via the Krebs cycle. Shortness of breath is due to the lack of hemoglobin binding to oxygen. Rapid irregular heartbeat because the body is trying to compensate for the increased demand in oxygen. Cold hands and feet because the body is trying to pull blood to the vital organs and away from the extremities. Restless leg syndrome, while not fully understood, is correlated with iron deficiency anemia because iron is an essential component needed for the production of dopamine. And dopamine, as a neurotransmitter, is involved in the regulation of movement. For clot formation, some types of anemias are more prone to increased risk of clot, such as sickle cell and thalassemia. So during the process of sickling, which is the process of polymerization of red blood cells without oxygen bind, red blood cells are more prone to stacking on top of another due to its sickle cell shape. Thalassemia is more prone to clot formation due to the inherent structure of the red blood cell. They're more fragile in nature and are more prone to breaking. As the red cells break, they release the intracellular components, which then can increase the risk of clot formation. Finally, we will discuss the acronym associated with anemia. Our acronym here is, oh no, mamma mia, pasta is fancy, while our character is stepping on some fragmented short glass. This acronym serves as a summary for the treatment option for the most common types of anemia. The acronym has a built-in parallelism where the first part of the acronym spells out the different types of anemia and the second half spells out the treatments of the anemia. The no in oh no stands for normocytic, ma stands for macrocytic, and mia stands for microcytic. PA are the treatment options for normocytic anemia, P stands for procreate, and A stands for RNESP. Both of these drugs are to help stimulate red blood cell production. IS stands for iron sucrose and is one of the mainstay treatment in microcytic anemia. External source of iron is used to replenish the low serum iron. So in regards to the oral supplemental of iron, fragmented short class is the acronym in regards to the lowest elemental iron percentage to the highest elemental iron percentage. F stands for fumarate with a 33% elemental iron, S stands for sulfate with a 20% elemental iron, and G stands for gluconate with a 12% elemental iron. Lastly, FANC is the first letter treatment for macrocytic anemia. F stands for folate, and CY stands for cyanocobalamin. Thank you for watching. If you found these videos to be helpful and enjoyable, please consider subscribing and hit that notification bell to stay tuned for future videos. Please comment below and let me know what other content you would like to see next. And as always, let's continue to empower a different way to envision success. And I'll see you on the next one.